Hi, this is Dr. A with your anatomy review of the cardiovascular system. All right, the functions of the cardiovascular system is to distribute blood to all areas of the body with the delivery of needed substances to cells. So we're thinking oxygen and nutrients and the removal of waste from metabolism. And the organs of the cardiovascular system are the heart, the arteries, the capillaries, and the veins. All right, so the cardiovascular system maintains the distribution of the blood throughout the body. So the blood delivers oxygen to the cells and also the other nutrients. So we're thinking like macronutrients, so your glucose and your amino acids and your fatty acids, but then also, your minerals and your vitamins and all the things that the cells need to function. And then it removes all the metabolic waste product from the cell and delivers them to the lungs for CO2, liver, and kidneys for elimination through, urine and poop for liver. Sorry. The circulatory system is divided into pulmonary and systemic circulation. So the pulmonary circulation carries the blood from the heart to the lungs and from the lungs back to the heart. And then the systemic circulation carries the blood from the heart to the rest of the body, except the lungs, and from the body back to the heart. So here they are illustrated. So as you see, we typically start on the right side of the heart. So as the blood that's low in oxygen returns back to the right side of the heart, it is pumped through the pulmonary arteries to the lungs, where in the lung capillaries it will pick up oxygen, and then the oxygenated blood will be returned to the left side of the heart through the pulmonary veins. And then the left side of the heart will pump this oxygenated blood through the aorta and the systemic arteries to the capillary beds of the body, all over the body, where it will deliver its oxygen and nutrients to the cells, pick up all the waste, and then return the waste in the blood via the venous system back to the right side of the heart. So there you go. Pretty simple. The heart is a muscular pump. It has 4 chambers. So we have the 2 atria and the 2 ventricles. It averages 60 to 100 beats per minute, or about 100,000 beats per day. That's a lot when you think about it. Each contraction will eject blood from the heart and pushes it through the body. The heart is located in the mediastinum, so this is kind of the middle there, and then to the left, and it's about the size of a fist. So the heart has several layers. So we're going to start with the inner one, what is known as the endocardium. It lines the heart chambers. It is a smooth, thin layer that reduces friction as the blood passes through the heart chambers. So this is a layer of the heart that is in contact with the blood that passes through. This inner layer is also continuous with the inner layer of the blood vessels, which is the endothelium. The middle layer is the myocardium. It is a thick muscle layer made with cardiac muscle, and the contraction of this layer, of this muscle, develops the pressure that is required to pump the blood through the blood vessels. And then the outermost layer is the epicardium, and it forms the visceral layer of the pericardial sac. So it's the visceral pericardium, and the fluid between the layers of the pericardial sacs reduce the friction as the heart beats. So you have the visceral and the parietal pericardium with fluid in between, and as the heart beats, then that fluid allows it to beat without friction. So here's a big schematic of the heart. So we have the atria here, right atrium, left atrium. So again, as we mentioned in my medical terminology body organization video, you have to remember that right and left is the patient's right and left, so it's always going to look backwards to you. So the left atrium and the left ventricle are really on your right as you look at it, and your right atrium and right ventricle are on your left if you look at it directly. It's because it's the patient's right and the patient's left. All right, so we have our chambers here, atrium and ventricles. We have a septum here. We have valves we're going to look at, and we're going to describe all of these and go back over them, but just for quick anatomy, we have the vena cava, so superior and inferior vena cava, to the right atrium, through the tricuspid valve into the right ventricle, out the pulmonary valve, through the pulmonary arteries to the lungs, from the lungs back through the pulmonary veins to the left atrium, through the mitral valve into the left ventricle, through the aortic valve into the aorta, and through the arteries to the rest of the body, and then we go to the capillary beds and come back through the vena cava. So the heart is divided into 4 chambers, as we just saw. The 2 upper chambers called the atria, the 2 lower chambers called the ventricles, and the septum divides the chambers into right and left sides. There can be some problems if there are any holes in that septum, and that's what is often referred to as having a hole in your heart. It's usually a hole in that septum, whether it's between the 2 ventricles or the 2 atrium, the right and left atrium. So the atria are the receiving chambers of the heart. It's also like in a building. The atrium is the receiving room of a building, so that's where the word came from. And so they receive blood from the rest of the body through the veins. The veins dump that blood into the atria. And then the ventricles are the pumping chambers of the heart, and they pump the blood out through the arteries. And the heart valves are very important. They force the blood to follow the path it's supposed to follow, what we call the forward path. So there are 4 valves, and they basically guard the entrance and the exit of the ventricles. So the tricuspid valve is an AV valve between the right atria and the right ventricle. And the pulmonary valve is a semilunar valve between the right ventricle and the pulmonary artery. So what happens is when the right ventricle contracts, you want the blood to go into the pulmonary artery and not back into the right atria. And so the tricuspid valve will be closed when the right ventricle contracts, but the pulmonary semilunar valve will open when it contracts. Same thing on the left side, except the AV valve, atrioventricular valve, is called the mitral or bicuspid valve. It's between the left atria and the left ventricle. And the aortic valve is a semilunar valve that is between the left ventricle and the aorta. And so, as I stated earlier, the valves are found at the entrances and exits of the ventricles. So here is the path again. So as you can see, we have an AV valve here and an AV valve here. So tricuspid on this side, mitral on this side. And so it allows the blood to flow from the atria into the ventricle, but not from the ventricles into the atria. So when the ventricle contracts, these tricuspid and bicuspid valves both close, and then it allows the blood to push through to the semilunar valves, whether it's the one that is opening to the pulmonary artery or the aorta. The conduction system of the heart is really important. So the contraction and relaxation of the heart are regulated by the conduction system. The conduction system is under control of the autonomic nervous system, so that's involuntary. It sets its own pace. You don't have to think about it. And there is special tissue within the heart that is made to conduct those electrical impulses that allows the atria and then the ventricles to contract as one unit and to contract in the correct order. So step 1, in the SA node or the sinoatrial node, which is also known as the pacemaker of the heart, it begins the signal. So it fires and begins the electrical impulse. And as it fires, a wave of electricity is going to move from the SA node through the atria, and that will cause the atria to contract. And then this impulse is going to reach the AV node or atrioventricular node, and so then when it's stimulated, it's going to transfer that stimulation down the AV bundle, also known as the bundle of His, and the right and left bundle branches, and it's going to go down the bundle branches and into the Purkinje fibers, and then that will cause the ventricular myocardium to be stimulated and to contract, the ventricles to contract. So the atria contract, and then there's a little bit of a pause, and then the ventricles contract, and there's a little bit of a pause, and then it starts over again. And so if your SA node fires 65 times a minute, then the heart rate will be 65, because 65 beats per minute. Here it is illustrated. And so we have the SA node here, the pacemaker of the heart, sending the signal to the atria, and then it reaches the AV node right here. After it's traveled through the atria, there's a little bit of delay. It reaches the AV node, and then it goes down the right and left bundle branches here, and then into the Purkinje fibers right there that are extending into the ventricles, and then the ventricle contracted with this little bit of a twisting motion to, force all the blood out of the ventricles and into the arteries. The electrocardiogram is a record of the electrical activity of the heart, also known as EKG or ECG, depending on where you're from. And the electricity that is recorded is what is happening in the heart. So we have the SA node fires, and you have the electrical impulses that basically have depolarization of the electrical impulses through the atria, and that is seen in the P wave. So as the atria contract right there, there's a little bit of a delay, and then there is the depolarization of the fibers here around the ventricle, which will cause the ventricles to contract and cause the QRS complex to form. So this is the big peak and valley here is the QRS complex when the ventricles contract, and then we have a little bit of delay. And this T wave is the repolarization of the ventricular fibers, and so depolarization and repolarization is the words that we use to refer us to what's going on with the electrical impulses. There are some electrons, some ions that are switching place as the electrical impulse travels, and they have to all go back where they belong. And so that's what's happening with the T wave. There is a repolarization of the atria that happens, but it happens here behind this QRS complex, and so we can't pick up on it. And this can give you a lot of information on how things are going on in the heart, how the electricity is being conducted in the heart, and it can give some indications, for example, if somebody's having a heart attack. All right, so let's move on to the blood vessels. So the heart is the pump that moves the blood, and the blood vessels are the pipes that circulate it. So there are three types of blood vessels. We have the arteries, the capillaries, and the veins. And then the lumen is the channel within the blood vessels, and it can be larger or smaller depending on which of the vessels you're in. So let's look at the blood vessels. So we have the artery on this side with the outer layer called the adventitia. And then the artery has an external elastic lamina and an internal elastic lamina. It has a pretty thick layer of smooth muscle to be able to build pressure and to contract or dilate the artery. And then it has an endothelium, which is a layer that's in touch with the blood. And then the lumen is just the space in which the blood is traveling. And the arteries will get smaller and smaller until they become arterioles, and then they become capillaries. And so the capillaries are only basically one layer thick, the endothelium with a basal lamina wrapped around it, which makes them really porous, and that's why it's at the capillary level that blood and nutrients can be delivered. And they are about 1 red cell wide for the lumen, so they're really, really thin. Then these become wider and wider. They merge together and they form venules, and then merge into veins. So the veins have the same outer layer called the adventitia. They also have smooth muscle, but a lot less than on the arteries. In the arteries there, they have a basement membrane, just like the arteries, and they have an endothelium, just like the arteries, except that the veins have valves to keep the blood flowing one way and to kind of counter gravity as the blood is trying to be returned upstream back up to the heart. The lumen of the veins is much, much wider than that of the arteries. So the veins actually hold a lot more blood than the arteries do. Relatively speaking, about 80% of the blood that you have is going to be in your veins at any one point in time. The other 16% is in the arteries, and the other 4% is going to be in the heart itself as it's pumping. And so some of it, of course, vein capillaries also have quite a bit of blood in them too. So let's talk about the arteries. So there are large, thick-walled vessels because they have more smooth muscle, and these have the ability to contract or relax. So they can change the diameter of that lumen to change the pressure. They carry blood away from the heart. So arteries carry blood away from the heart. AA. Arteries away from the heart. The pulmonary arteries goes to the lungs, the aorta goes to the body, and the coronary arteries go to the myocardium of the heart and they feed the heart muscle. As the arteries branch, they become smaller and smaller until they become arterioles and until they become capillaries. This is an illustration of the coronary arteries. So the first branches off the aorta with the freshest oxygenated blood are supplying the heart muscle with the oxygen that it needs to keep contracting and keep pumping, because that is the most important thing, is for the heart to keep pumping. So next are the capillaries. So they're a network of tiny, thin-walled blood vessels, and they connect arteries and veins. The oxygenated arterial blood flows into the capillaries, and then the oxygen is delivered to the cells with nutrients, etc. Waste are picked up, and then the deoxygenated venous blood would flow out and go back to the veins. And this is true for the systemic circulation, and this is how we learn it. We kind of learn it in the systemic circulation. Just in pulmonary, it's backwards because you have deoxygenated blood arriving through the arteries into the capillary blood and oxygenated blood leaving through the veins. That's for the pulmonary circulation. So there are the place of diffusion, which is where basically it's nutrient exchange. Oxygen and nutrients diffuse out into the tissue and cells, and the carbon dioxide and waste diffuse in. And then the vein begin as venules on attached to the capillary beds, and they gradually merge and become larger and larger veins. They are thin-walled, they have valves, and they are low pressure, and they carry the blood back towards the heart. The pulmonary veins do carry blood from the lungs, oxygenated blood from the lungs back to the heart, and the superior and inferior vena cava carry blood from the body back to the heart. So blood pressure measures the force that is exerted by blood against vessel walls, but more specifically, we're always referring to this as actually arterial pressure, because the pressure is too low in the venous system to measure. During systole is the contraction of the heart. The blood is under a lot of pressure and gives the highest reading because the heart is pushing all that blood into the vessels, into the arteries. And during diastole is the relaxation. The blood is under little pressure and gives the lowest reading. So a typical blood pressure that is normal would be 120/80. So 120 is the systolic pressure and 80 is the diastolic pressure. The blood pressure may be affected by characteristics of the blood and the blood vessels. So the elasticity of the arteries, how well they bounce and they can contract and relax also, but also their diameter. So if there's something that's causing all the diameter of the blood vessels to be contracted, it will raise the pressure in those blood vessels. The viscosity of the blood, or how thick blood is. So, it's kind of the difference between, are we pushing, watery fluid, or are we pushing thick viscous fluid? And the amount of resistance to blood flow. So things that can cause resistance to blood flow can be the diameter of the blood vessels, but also like plaque and other things that can accumulate on the inside in the lumen of the arteries. The pulse is the surge of the blood caused by the heart contraction. So we can feel your pulse here at your wrist, there, or here in your neck. In general, the pulse rate is equal to the heart rate, so that's a quick way to assess a heart rate. And lastly, here's an illustration of what it looks like. So if you had a normal amount of blood into a normal blood vessel, you would have normal blood pressure. But if you have a normal amount of blood into a narrowed blood vessel, whether it's narrowed by plaque or narrowed because the artery is constricted, then you have high blood pressure. That's your illustration. So sorry, this is a little bit lengthier video, but that was your review over the cardiovascular system, and I hope you found that helpful.